everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I'm your co-host, Dr. Eryn Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, you'll be hearing from myself and Dr. Eryn as we are guests on the FIT40 podcast with Bryan Fitzsimmons. This will be episode 387 on the FIT40 podcast, and it will be my second appearance on there. So Dr. Eryn will take the lead here in this episode. So sit back, enjoy, and make sure to check out Bryan's podcast, the FIT40 podcast, when you get a chance.
All right. What's up, everybody? Welcome back for another episode of the FIT40 Podcast. Today, we have another incredible guest with us. We have the dynamic duo of Balanced Bodies. We have Dr. Eryn Russo and Vinny Russo in the house. Dr. Eryn Russo is the Chief of Preventative and Occupational Medicine at Hill Air Force. She is Harvard and University of Utah trained. She's associated faculty at University of Utah. And if you want to know all about Vinny, go and check out our episode from, a couple months ago. It's going to be down in the description in the show notes. Just click away after you're done listening to this, and then you're going to have about 2 hours of incredible information. So welcome, guys.
Thanks for having us on. Yeah.
Thank you so much, Bryan. We appreciate your content, and thank you for taking the time to talk to us.
Of course. I mean, I love having people such as yourself on because I think what you guys do at Balanced Bodies is incredible with the 1-2 punch of not only having the nutrition coaching, the physical side of coaching side of things, but also having the medical integration as well. And I think that really serves people the best way that they possibly can be served. And I wish it was a little bit more widespread. So can you tell us a little bit about how you guys do things and what that looks like? So if anybody's trying to do their own makeshift version of that, if they already have a coach per se, but they want to include medical staff, so they have the whole approach, what does that look like?
So I think it's interesting. So my background is I'm board certified in preventative medicine. Preventative medicine, basically, it's funny because people talk about longevity medicine, which every doctor's a longevity medicine doctor because we're trying to...
Not just Peter Attia?
Yeah, no. And so I think if anybody is probably more concerned, it's probably my specialty, in that we're the doctors that are telling you when to get your health screenings done, your cancer screenings, checking your lipid panels, that sort of thing, and trying to implement lifestyle modification. And so when I very rarely actually wear my preventative medicine hat. I do a lot of occupational medicine, which is what you mentioned. I'm chief of Hill Air Force Base for. And so we deal with toxic exposures and stuff like that. So when I met Vinny, who is a nutritionist, I was like, ooh, this is a great collaboration, where he already had clients. I call them patients because to me they are patients, where he had clients that he was trying to help with their nutrition coaching and their lifestyle changes. And if anything, we thought we could come together because as many patients feel unheard when they go, for example, to their primary care physician, oftentimes they're sent away with, hey, your cholesterol is really high and you need to change your diet. And that's literally all they get from their doctor, and that is a failure of the medical system, to be honest, because doctors, especially primary care doctors, I love them. They do a huge service to humanity, but they don't have enough time to spend with their patients. They just don't. And the way that our American insurance system is they really aren't rewarded or reimbursed to give their patients the lifestyle modification advice that they might need. And oftentimes primary care physicians aren't necessarily trained in that area. And so they really, are trying to do the best they can with their patients and with the time that they have. They oftentimes will send you away and say, hey, you need to change your diet. And sometimes patients will say, well, how do I change my diet? And they'll give them very generic advice, right? And that's all they have time for. And then, in addition to that, there's not a lot of uh, follow up, if you will, on the primary care side, besides following up with labs and stuff like that. But a lot of primary care docs don't have a lot of time to follow up with, like, hey, how are you doing on those diet changes? Are you losing weight? What's going on with that? They just simply don't have enough time in their day to do that kind of follow up with their patients. And so when I met Vinny, I thought, wow, what a great opportunity to come together with something that I'm not well versed in, right? Um, and we can get into this a little bit later, but I'm not an expert in nutrition. I can tell you from personal experience and what kind of training I've had in nutrition, but he's a nutrition expert. And so what a great opportunity to, be able to have a patient and be like, hey, you need to implement these lifestyle changes. And here's the person that I'm going to help, that's going to help you do that. And that's going to hold you accountable, that you're going to have to check in with. And then, you know what, we're going to check your lab markers, your cholesterol panel, and see where your weight is, see what your BMI is. And yes, we still use BMI, and we can get into the separate discussion. See where you're at with that. Did we decrease your cardiovascular risk factors in any significant way? And that's where that longevity and that prevention comes in, right? And so I saw it as a venue to help patients in a very meaningful way. Instead of just sending them off and being like, hey, here's a handout on the Mediterranean diet. This is what you need to do. And then they just get lost to follow up, and there's no accountability after that.
Yeah, and I first off props because I think one of the things a lot of people don't see a lot from their physician or anybody is like admitting there are failures on the medical system side of things. Like let's just call it what it is. There are shortcomings no matter what we're talking about. So like when we can acknowledge that, it helps us make that bridge that because right now it feels like there is a bit of a disconnect on that. And
Yes.
I've even seen like, I mean, we can all admit nobody's an expert in everything. It's like unrealistic to expect that from even your doctor to like know all there is to know about nutrition. I've heard some of the worst advice ever from friends that I have that are physicians where they're like, what do you think about carnivore diet? Or is not eating anything white like good diet advice? And I'm like, oh God, where do we start?
Yes, yeah,
Um,
exactly. Right. And
but
I think
yeah,
it's good to admit, like, all right, I'm not an expert in this, and I'm gonna, even as a physician, I'm not an endocrinologist. If you have, a major thyroid issue or you're diabetic, I'm oftentimes gonna say you need to see your endocrinologist. I'm the first one I have a very low threshold for referring patients for chronic diseases. Let's put it that way.
yeah. And would you say
Because
that's like a green flag if somebody does have a physician that they go to, whether it's a PCP or somebody else that's really like quick to refer out and be like, hey, I want you to find somebody that actually like this is their specialty.
Yeah, I think I always look at medicine and advice to patients as what I would tell my mom. What advice medically would I give her? And I often tell my patients that if you were my mom sitting here, this is who I would tell you to see, just so that you're getting the best kind of healthcare that you can. I mean, again, there are many faults of the American health system, including insurance, and we can go off on tangents all day long about that, but we
I think
do have.
we could just say we could chalk up pretty much 99.9% of the problems to insurance.
Yes, yes,
Yeah.
there are some excellent physicians here in the United States, and they are very well trained, they're very knowledgeable, and it's just getting plugged into the right people. And we talked about this on another podcast, but having a multidisciplinary team that communicates well with each other, right? And so that is essential. So not just a bunch of referrals to different specialists, but are those people actually communicating? It does your internist, your primary care physician, are they amenable to that communication from the other specialists, and are they communicating that to you? That's really, really important as well, right? Because we can refer all day long, But if the doctors aren't communicating with each other, then it does a disservice, I think, to the patient as well. So having that communication, having a multidisciplinary team that's constantly communicating about your care. And unfortunately, sometimes patients have to advocate for themselves and they have to say, hey, this is what I need and this is what I want. And to be honest, that's kind of what we tell our patients as well, right? Oftentimes, our patients or our clients, as Vinny talks about them, come to us and they don't know what questions to ask their primary care. I'm often saying you must have a primary care. I'm happy to communicate with them. We're part of your team. We're trying to help in the best way possible so that you have good health, and not only that, but good quality of life later on in life, because making these lifestyle changes are not only right now thing, they're a lifelong commitment. And really that's so important. And if you don't have a team on your side that communicates well, it doesn't work well.
Yeah.
I'll interject here real quickly. And look, you guys are
Mhm.
not going to hear a lot from me. I was already on a solo podcast with Bryan before, so I'm stepping back. But I will say it's so important to have the same message from everybody on that team, which is why communication is so important. Otherwise, you might have a client being pulled in the left direction, in the right direction, forward, backwards, and it's just confusing the client. So to get everyone on the same page and deliver the same message, it makes it that much easier for the client to not only like understand why they have to do what they have to do, but there's also buy-in because everyone's telling them to do that same thing and they buy into it and then they reap the rewards of actually following through on what the multidisciplinary team actually says to do.
Yeah.
Well said. And I will say another good thing too is like if you leave room for the true expert in the discussion to be like the leading voice, where it's
Yeah.
like I'll say stuff where people are like clients are going to physical therapy and I'll be like, honestly, I think this would probably help and like they're probably going to focus on this, but at the end of the day, they're the expert. Like listen to them and then come back to me with the good stuff and then we'll incorporate it into your program so that way it's a little bit more respectful and everybody's getting the best for that client, that patient.
Exactly. I think it's knowing as an expert or as somebody giving advice, you need to know where your limitations are and where somebody's expertise start. I often tell, when I'm talking to a patient about, they'll ask me a nutrition question, for example, and I'll say, to be honest, Vinny's the expert in that. So I'll let him know that you had this question, but you should ask him as well, because that's not where my expertise comes in. My expertise is like, hey, listen, let's look at your lab work. Let's look at your cardiovascular risk factors. Let's talk about like what those look like. But if you want to know what you're going to eat day to day, that's not me.
Yeah. Yeah. But I thought coaches could just read my lab work. Can I just pay $500 and get some AI spit out for me? Like why not do that?
Well, you could, and you're free to do whatever you want. I wouldn't advise it. Again, if I was sitting here in a room with my mom and giving her advice, I would not recommend that. And the reason is, so, it's funny, you think a coach can take an online course and know how to interpret lab data, but that is so far from the truth. Now, most lab data that you get, you get ranges and you can look at the lab data and you can say, oh, well, this is abnormal, this is normal. And you think that you might, know what you're doing. I think it gives you this false impression. But unfortunately, medicine is practiced a lot in the nuances, right? And so small abnormalities, plus physicians take into account the clinical picture. It's not just about your lab numbers. So you can. I heard Vinny talking about this on another podcast about how there's these functional panels that you can order online where you pay a flat fee and you get like 500 tests or whatever. Um, but what happens with that? And we can, there's why you shouldn't do that. But you get the lab test results back, and then maybe they give you a range, and maybe you see like a few red numbers. What do those numbers mean? What do they mean in the context of the patient? That's something that you won't get from your nutrition coach. They don't know enough about patient care and about what abnormalities really look like, one in a hospital setting, in an emergency setting, or any of the subtleties that might happen with maybe the early signs of a chronic disease. And so that will be missed oftentimes. And either it will give you a false negative saying like, oh, well, you're fine when if somebody looks at the entire clinical picture, they might be missing something, or it might give you false positive where they might say something alarming, which I think happens more often because then they can sell you something, right? Like, oh, this is just off a little bit. Let me give you a supplement.
That's the reason why you didn't lose weight, because of that one number.
But don't worry, I got an affiliate code. I can save you some money.
Yes. Yeah. And so that is often missed. Now, when you look at the training of a physician versus a coach, it's a hell of a lot different,
What are you
right?
saying?
It's a lot
Wait,
different.
not all coaches like did like 10 plus years of post grad work. Is that what you're saying?
Yes, I am saying that. Yes, absolutely. I'm saying that. And not only that, but they haven't worked in clinical settings and seen different clinical examples at play in real time with real people's lives, with real physiology, and what kind of impacts that means. They haven't treated that, they haven't seen that. And I would really caution somebody against trusting a coach with lab work, period.
Yeah. And I think it's like easy for me and Vinny to say this because we're in a very unique position where our spouse or my fiance, soon to be spouse, are
Yeah.
MDs. Like we understand, like when we come to you guys with these things and you're just like, well, this is bullshit. This is bullshit. That's wrong for this reason. And we're like, as coaches, it's sometimes hard to know who to trust because people put themselves on a pedestal and we're like, this guy or this girl knows what they're talking about. And then in reality, they don't have a damn clue. They just say a lot of words that sound legit, and then we have no filter to be like, oh, this is true or not. So now you got these coaches that are well-meaning pushing out these bad like advice, bad protocols and things like that. And for example, like people become super reliant on technology. They're like, oh, I could just do this $500 test and it'll tell me all these things. Meanwhile, it's like, do you know how many times doctors will like disregard what the text says and actually take a look for themselves, like with an EKG or something like that, where it's like machine says one thing and you're like, no, that's wrong.
Yeah, yeah. I completely agree with you. And not only that, but like with these, lots of testing doesn't always mean good things, right? So in order to have a test, you need to know what the clinical outcome is going to be and what you're going to do with the information and whether the information is valid in the first place, right? So we in medicine do not try to test things that one, we don't know what the clinical guidance will be after we test it. And not only that, but how good is the lab test? Like, is it clinically verified? Because if we get an answer for you, what are you going to do with that answer? Now, I can tell you what a functional provider will do with an answer. They're going to try to sell you something, or they're going to try to tell you that something is wrong. And that is their in to tell you or to make some money from you, essentially, to play on your vulnerability, to say, I found the problem for you and now I can fix it for you. And that is
They
not in
they
the best
found the
interest.
root cause.
Yes, I hate that word so much.
They
I
were
feel
able
like
to
if you, what's
go
that?
ahead. No, I was just going to say they're able to find what your doctor couldn't find
Yeah,
because we did a
Yeah.
test that
they
your
have a
doctor didn't want to
secret.
do because insurance didn't cover it.
Yes.
Yeah, because I think at this point, anybody that does use root cause and they don't provide the nuance of like root cause means like 10 different things. Like if you really think it's one thing, then you truly don't understand disease state or anything like that.
100%, which I'm going to use your tagline 100%. Because
Tag.
there's complexity, right, in medicine. It's not just one. That's why I hate root cause. You don't know the root cause because half the physicians that have been studying the disease, that have been treating people for this disease, don't know the root cause. They don't. And I'm happy to sit here and tell my patients, you know what, we don't know why you have this. We don't. But these are the steps that we can try to take to help alleviate these symptoms, that sort of thing. But we don't know why. We're still doing the research. We still need to figure out why this, XYZ happens. And so I hate when people say, oh, we're going to find the root cause. How? You know,
Well, I mean, there's this pretty well-known chiropractor, Dr. Trevor Bachmeyer or something like that. He's all over social media. Talks really fast, talks really eloquent, knows a lot of big words. he's like, hey, yeah, well, asthma's not really a disease, and this is the reason why. And like goes into it. So wait a minute. And he talks so quickly, so fast, and you think he knows what he's talking about. And then he's like, comment here, and I'll give you my peptide protocol guide on how to fix it. It's like, whoa.
Yeah.
Yeah. And
My other pet peeve now that's coming out is a protocol. When somebody says I have a protocol, what? Am I a lab rat that you just figured out how to test like some peptide or some chemical on me and now you're gonna like run your experiment on me? I'm gonna be your N of one, your trial of one human.
yeah.
So yeah, I hate root cause protocol. It sucks because when we started our company initially, we used the word wellness, and I now kind of get cringy when people say wellness because now what is associated with the wellness industry just is so against my ethics in medicine,
Well,
right?
even the word we used holistic a lot as well, right?
Yeah.
When we first created it, because that word had actual meaning to it. Now it's just like
Yeah.
it's what's the word? It's stained. It's
Yeah.
stained by
It
like
is.
the word used in social media, and
Yeah.
it's sad. But yeah, we got to keep like re-looking at. I had to look at our website, and I had to go through and be like, we're not using that word. We got to change this. We have to change that because when we first started it, what was it, 2021, the
Yeah. Yeah.
company? Yeah, we had all these cool words in it that actually meant something, and all of these words have been stained by what's been going on in social media that we had to take them all out.
Yeah, I get, and it's
Easier way to say it. Yeah.
being on the medical side and not on the social media side. Not, I mean, this was something that Vinny introduced me to, this whole new
You're welcome.
world of like this this crazy, like these nutrition tips and stuff like that are on social media. And I was astounded. I could not believe how much misinformation is out there and how these people are capitalizing on patient vulnerability. It
Yeah.
really is that. And they are repackaging it and selling it back to the person at a cost. And we complain about how expensive, medical insurance is, that our American health system isn't great. And maybe that's why these pockets exist. But I think these influencers that are giving out this kind of misinformation are doing real harm to real people. And I think that's the part that really, really gets to me. It's like you are harming patients. You are actively harming and playing off their vulnerability to take advantage of something and then make money off of them. And that really, really bothers me.
Yeah. And I think it like at the end of the day, it's like for them, it's makes money make sense. And you could almost justify it in their head as like, oh, well, even if this doesn't do anything, it's not hurting people. But at the end of the day, it is because people are not seeking out medical care because they're like, oh, I've already got that box checked. Whereas
Yeah.
if they were seeing a physician, it's like maybe they'd catch something that this person who's severely unqualified would not catch. Because
Yeah.
I think unfortunately, like I mean, social media is great for a lot of things, but it's also really horrible for things like presenting a false equivalency. Like you see somebody that is super credentialed, super educated in the exact same feed as somebody who claims to be an expert who has no training whatsoever. So
Exactly.
to paint the picture for people, because I think when I met my fiance, one of the first things that really stood out was like the level of education. I'm like, yeah, she's a doctor. And then she went into how much they actually do. And I'm like, holy shit. And then you see the amount of information that's required to learn in X amount of time. And you're like, I'm convinced doctors are superhumans at this point. I physically cannot take in that much information that fast.
Yeah.
Well, I appreciate that, and props to your fiance for conveying that to you as well. Yeah,
She did
we
a good
go
job.
through. Yeah, I think a lot of it comes out in our spouses or our significant others because sometimes we start to complain about it too because we're human beings. Doctors are human beings. So
On the verge of human animal. We're right
Yeah,
up there.
close, close.
Yeah.
but yeah, we go through an enormous amount of training. So
Let me go through yours.
yeah, so I'll go through like
You did because you went extra routes too.
yeah,
Yeah, and didn't you start really young?
I did. So I started, I was a nerd my entire life. I was super, super nerdy, super I was the kid during summer vacation that would read the encyclopedia and memorize the periodic table for real. So I started college when I was 14. I never graduated from high school, so I don't have a high school diploma. So if you want to,
Well, everything's out the window now. We can't
I
listen to her
know,
people.
right? I'm sure more of the nutrition coaches probably have that qualification at least. Anyway, I started college when I was 14. Um, I was a biology undergrad. When I was 16, I actually, so I knew I wanted to be a doctor at a very young age. So I knew when I started college, this was what I was going to do. I also knew what kind of time commitment and how long it was going to take me, which is why I wasn't afraid or sad about starting college early because I knew it was going to be a long, long haul. But when I was 16, I actually was a patient. So I was diagnosed with acute promyelocytic leukemia when I was 16, and I was treated for a year with chemotherapy. I was an inpatient for most of that time. At the time, they didn't have, some of the great treatment that they have now, where they send you home and that sort of thing. So I was in the hospital for most of that year. So I know what it's like to be a patient. I know what it's like to be told, they still don't know why my type of cancer occurs. It's not genetic. It is a kind of a random thing. There's what we say in medicine, an unknown etiology. We don't know why it occurs. That was really frustrating for my mom. And so I saw up close, what she struggled with the medical system. The medical system is not perfect at all, and doctors are not perfect. But I had some damn good doctors that saved my life. I will say that. And I am grateful to Western medicine every single day because of it, because I would not be here if they had not treated my cancer, or if she thought, that vitamins would heal me. I
Or
would have
some
died.
juice cleanse or something
Yeah.
like that that's pushed now.
Yes, I would not be here today if she had bought into any of those things. So thank God she did not. I got treated. When I got better, I went back to finishing undergrad and graduated. I started medical school. I think there was a year gap in there. Um, and I went to another 4 years of medical school. I graduated from medical school fairly early as well. Probably could have been earlier, but cancer threw me off. And then I did, so that's another 4 years. So you're looking at 8 years right there. Um, then I did a surgical internship in Seattle, Washington. I thought I wanted to be a surgeon. And
And
it
you
was
did it in Grey's Anatomy territory.
I actually, you know what, they actually based that show off of the group of residents that I did my training with. And
Really?
they came to interview us, and the day that they interviewed us, I was post call, so I went home to sleep. So I never
Oh,
got interviewed for that. But uh interesting. Anyway, but it's not like Grey's Anatomy. It
that's
was
going to be the episode title now. Grey's
yeah,
Anatomy
yeah.
based doctor tells all.
Yeah, it was great. A great year. I loved doing surgery. I hated call, and I knew that at some point I wanted to have a family, and I knew that probably being a really, really good surgeon it would be very difficult to have a family life. And so I decided against that. I came home and actually did cancer research. And I did it in PET imaging, which is, is probably not something you're familiar with unless you do cancer imaging. But we did PET CTs and that sort of thing. So I did a year of research, and then I actually applied to residency program at Harvard and went into nuclear medicine, which is what PET imaging is. So it's a lot more training. I went off to Harvard, did that training, missed clinical care, did not like taking call. So again, I came back, I did more research. So I did 2 years of clinical research in a cancer setting. And then I got into occupational medicine and preventative medicine, did another residency. So we're looking at another couple years. I also, during that year, got my master's in occupational health, which is equivalent to public health, like a master's in public health. And then finally boarded in that and got my first job. So we're looking at, how many years? 8. So 8 plus 2 years of research plus 3. So, you know, what, 12, 13 years?
More than that.
Yeah. Of
2 years of
training.
research plus the 3
Yeah.
years. Yeah, so you're looking 15, 16.
Yeah.
Yeah,
And
but
so
see, I just got my year-long functional training cert, so I know more than you. Just saying.
right?
Well, I don't mean to cut you off at all because this stuff's very important. But on our podcast, I brought up the fact that a very well-known functional practitioner brought up the fact that some guy commented on his post who was a resident and was like, "This guy talking about the functional practitioner doesn't even know what he's doing. He never made it to medical school," and he knocked him for, "Oh, we don't have time to. People are sick now. We don't have time to wait for you to go through all the schooling." Just to give us bland answers. I'm like, that's the dumbest thing I've ever heard in my life. They are going through all the schooling to be the experts they need to be in order to save lives and improve health. And it was just such, oh man, I every time I think about that, I get so aggravated because how ignorant do you have to be? And this guy's so well known and he's liked by so many people. I even liked him at one time. I did. I actually trusted him until I read the research he was putting out, and then other things happened. And I was just like, yeah, this guy's just
Yeah.
manipulating people.
I think
And
it
that's the
was
trick. That's
a
the tricky
misnomer
part.
to say research.
It's true. Yeah.
He
That's
puts
the
out
trick.
content, not research.
Yeah, very, very clear distinction there. But it's tough because people put out like 90% probably good stuff, and then they warp that 10%, and you're like, "Mm."
You know, they're almost believable. And I can
Mhm.
see, like I said, I always think of my mom. And so, and she comes to me often and says, "Hey, you know, I saw this poster, I saw this thing," and she buys into some of the stuff. But I can understand if you don't have a medical background and you don't know, or even a science background, it is believable. And that's what makes me so angry. I'm like, you are playing on people's one that they don't know enough and their vulnerability. Everybody
Yeah.
talks about their health. Everybody does. It's very important to them because that's why we're on this earth. And if we can stay longer and with a better quality of life, we're going to want to know what that looks like. And anybody that has that answer, we're going to listen to. Like, I get that as a patient. And so, one of the unique things about me probably is that I was a patient. So I get it. I get, you know, what it's like to sit in a doctor's office and not have answers. And so I can empathize with that. But that's why I feel like they're doing such a disservice to people because it's like, oh, I have the answer. No, you don't. I've done, you know, I've almost been in clinical practice for 20 years now. I don't have the answer. How do you have the answer? You've never even worked in a hospital. You've never treated a chronically ill patient in the ICU. You've never done surgery. You don't even know what that looks like. You would
Yeah.
probably cringe at drawing somebody's blood,
I'd pass out.
you know? And
I'm
so,
sure I'm sure you could think of a few attendings that would probably make them cry on rounds if they were
oh,
there for a
100%.
day.
Yeah, like I don't understand how you can sit there and on your pedestal and give somebody advice that might harm them, might change their life in a harmful manner. Like that just seems reprehensible to me.
Absolutely. And this is why I'm so like happy that you decided to come on here and had a couple of other physicians come on too, because even doctors on social media, sometimes not even 100% trustworthy. I know my fiance mentioned somebody she went to medical school with who was like one of BuzzFeed's top 50 doctors to follow, and the guy
Mhm.
flunked out.
Oh yeah.
He didn't even make it through medical school. He had to go through again. And luckily he knew somebody who knew somebody. Otherwise, if he was an average Joe, never would have even been a doctor. So it's like,
Right.
do you want to really follow that guy or the maybe your doctor who you go to down the street who actually is legit?
Yeah, well, and I think, yeah, so just like in any profession, there are good doctors and bad doctors. And let me tell you, as on being on the patient side, I've seen some bad doctors, right? They either had bad bedside manner, whatever, or maybe they were, you know, preaching something that wasn't
Yeah.
completely
Like
accurate. And
they don't
I'm
keep up with the guidelines, stuff like that.
exactly. And I'm not going to sit here and tell you that, you know, no doctor doesn't want to make money or, you know what I mean? Like some of them have that propensity to be like, all right, how can I, you know, sell a supplement or whatever. So I'm not going to sit here and say we're all saints or anything like that. But just like any any patient out there, you should be vigilant. You should do your homework. And the doctor that you see face to face, that's a person that you should trust and that you should have a good relationship with, right? Because they're going to be in charge of some of the most intimate parts of your life and also give you advice on the most critical things that likely will affect you not only now but later. And if you think that a coach can give you that same advice, you should be extremely vigilant about what kind of training that person has had. And I honestly, like, I don't think that they've had the kind of training where I just said, where they took care of somebody in the ICU, saw them, during surgery, or even like, know what their scans might look like, know how to put the clinical picture together. They're missing that. There's no way that they got that training unless they went through medical school. Like, there's just no way to equivocate for that.
Yeah, because a lot of people know things that should work, but a lot of people have no idea what not to do. And that's
Yeah.
really where the true experts lie is like, I know what works, but I also know exactly what not to do because of X, Y, and Z.
Yes. Yeah, absolutely. And not only that, but if you are saying like, hey, I know this secret that nobody else knows, that should be a huge red flag to
Sounds
you.
good. Sounds
Yeah.
good though.
Huge red
Yeah.
flag to anybody.
I
And what
want to know. If you know a secret, man, I want to
yeah.
know.
Yeah,
And I'll share
that's like the
what
fat
secret
loss
is.
supplements that
Yeah.
promise they're the secret. It's like I'll tell you, Ozempic was a secret for about a day.
Yeah,
As soon as
exactly.
something's like legit, everybody knows it's not a secret.
Yeah. Yeah.
Yeah, yeah. And so, and that's the thing is like, who are you going to run to when you actually are critically ill? I hope it's a doctor. I'm pretty sure it's going to be a doctor.
Yeah.
If you need your appendix out, or you need, if you are really,
Listen,
really
yeah.
sick.
You had a heart attack. I hope you don't call me. You better
Yeah,
call her, not
yeah.
me.
And so
Yeah,
like
that's when you hand the phone.
Yeah.
so I think it's sad that right now, with what's going on with our healthcare, there's a lot of mistrust and distrust in doctors, and I think it's our job to regain that trust. But at the same time, we've been doing this for years and years and years, and we will continue to treat patients in the best way possible. We took an oath to help people and not to harm people, and we will continue to do that no matter what. Even if people hate us and condemn us and sell supplements, we will continue to do our jobs.
Yeah. And I think it all starts here with like having these open communications and people really getting a behind the scenes look. Because I think, at least from the outsider's perspective, like institutions like AMA or other ones have been very good at just putting their head in the sand and being like, it doesn't matter. It doesn't matter. Like social media presence and being forward facing. And I think physicians are doing such a better job of like helping people understand all these nuances. Like Dr. Mike comes to mind, people like that, where it's
Yeah.
like, okay, now we're getting solid information from somebody who happens to be good on social media, well spoken, like yourself too. So it definitely all helps.
Yeah, I think it's good that more doctors are getting into social media that are actually qualified, right? And so oftentimes, like I mentioned before, my mom will say, "Hey, I saw this," and I'll say, "Well, let me find a physician that actually has some credentialing who has commented about that." And it's awesome to send those videos. I can appreciate the physicians that take the time. This isn't, I mean, most physicians aren't paid for this, right? This is something that they do out of, the kindness of their hearts oftentimes. Now, I'm not saying all of them, like I'm sure some of them are compensated, but at the very beginning, especially when they're just getting started, I try to put out some content and it's like nobody's paying me for it. I just feel bad for people. I just don't want them to listen to bullshit. And
Yeah.
there's so much bullshit out there. And I think it's so hard as a patient to actually know what's true and what's not true. And unfortunately, it comes down to who you trust. And sometimes, the influencer has nice words and flowery, speech, and they get to you. And I could see how they could get to you.
I told her from the beginning. I was like, so I'm very combative online. Like if I hear bullshit, I like to call it out. I don't care. I'm gonna call it
Yeah.
out. I was like, but if you called it out with your credentials, they can't say anything back to you. They could look at me and be like, "Oh, I went to more school than you, and how do you know?" Blah blah blah. Or the big thing now is once they look into me after I comment, and we have a little back and forth. They're kind of like, "Oh, what are you riding your wife's coattails?" And it's like, "Yeah, maybe I am. So what?"
It's like, if I am, so what?
Yeah.
Yeah.
Well,
She's
that's
telling
like
me
we're
I'm
a
right.
team.
She would be
Yeah.
so because she's very good at calling out the bullshit too, but she's just like, I'm not going to waste my time doing it. I'm like, you would be such a big hit if you chose to take that time and actually do it because like you have an answer for everything. As negative as that might sound, it's a positive thing because she has an answer against all this bullshit information coming in.
Yeah. And it's backed up with receipts. Like you can
Yes.
pull up citation after citation and be like, this is why I'm right.
Yeah. Yeah.
Well, and I like that backed up with receipts. I like that.
Yeah, I'm a big Bravo guy, me and my fiance. So when they bring the receipts, I'm like, yes.
That's awesome. That's awesome. Yeah, I think
Is that Andy Cohen?
Yep.
Yeah.
Real Housewives, Southern Charm. We're
I
on
met him
it.
in real life. He's a
he's
nice guy.
I feel like Vinny has almost been like casted so many times. It's
I feel like
I'm the almost guy.
he'd be a great Housewives guy, like the
he
guy in the
would.
mix.
Although I don't think he doesn't have enough drama. You need more
Oh
drama.
yeah, I'm not a big drama
Yeah,
person. Like I'll
yeah, you
pull
need
shit
more
out, but
drama.
I don't really
I
like
was
to
gonna
be.
say, you just said you go to bat on social media. I
I
mean, I
like to
feel like
pull
you could
shit
do it for the
out, but I don't like
camera.
a lot of drama.
That's where the acting comes
Yeah,
in.
yeah, yeah.
That's where
Totally.
the anyway,
Well,
but yeah, sorry, we
yeah.
digress. I think that's hard for physicians, right? I think it's funny. So like coaches, I was talking to Vinny about this. Coaches have to reinvent themselves in order to sell stuff all the time. Like it's a constantly changing landscape, right? So I can see the perspective of like, well, I have to reinvent myself and I have to sell a protocol or I have to get into peptides because if I don't, then what's my business going to do? And oftentimes that's your livelihood, right?
Mhm.
Guess what? Doctors don't have to do that. I don't have a shortage of patients. Like they're always going to come see me, period. And so it is hard because, during patient care and actually, treating people and being concerned for their health, do we have time to post on social media and comment on social media? It's hard. We don't have that luxury oftentimes. I'm lucky because my clinical job is, a low stress environment. Plus, I've been doing it forever. So, I've established my practice so it's not rocket science. And so I have a little bit of time, but I honestly won't sit there and argue with people. I think I look at it like my smokers that come to me. If you're not ready to quit smoking, if you haven't bought into that, I'm not going to sit there and give you a lecture on how smoking harms you and that you should quit smoking. I will tell you, think about quitting and that's it. And if you're not ready, I'm not going to preach to you because you're not ready. And so I see it like that. And I see some of the people on social media, seeking these answers sometimes. And I'm like, I don't think they're ready for the answer that is probably needed in that discussion, unfortunately. And so, um, I think we need to do a better job of talking to our patients one to one, and that happens in a clinical setting and not on social media.
Yeah. And it really requires that level of trust, like you alluded to before. Like you should trust your physician. Like, and if you don't, it sucks and it's going to take like finding the right appointment. But it's like when you find your person, like it's literally your health.
Yes. And you should find your person. Let me emphasize that. If you don't like going to your primary care, find a different primary care doctor. There's good doctors out there, I promise.
Yep.
You
And
just
shout
have
out
to
to
be your
my
homework.
PCP, Dr. Wang. You are the man. He literally like
Exactly.
he whipped out one of these because I had a question about my ear and he showed me ear anatomy like on a whiteboard. I'm like, you are my guy.
Yeah, yeah. That's how it should be. You should be like this doctor. I can talk to you on a personal level. They're going to educate me about my health problem. They're going to give me good advice. I trust this person. I have a good rapport with them. I feel like they care about me. That's really important. Your doctor should have all of those things. They may not always have all the time for you, but they should be able to answer your questions and get back to you and have good follow through. And if they don't, get a different doctor. It's okay. There's lots of doctors out there. Get a different one.
Yeah. And because you just brought up the time thing too. I think that's really the big differentiator when it comes to, like, say, nutrition and lifestyle change and all of that, is really just having the time to sit with somebody and talk things out, which unfortunately a lot of models just don't allow for. So, like, when it comes to preventative medicine in particular, like when it comes to the lifestyle change of things, what are some things that you like to guide people towards, and then maybe hand off to Vinny, or like direct them to try and get like some guidance in those areas? Like, what are those big rocks that you look for?
So typically, like if I'm looking at their lab work and stuff like that, one of the biggest killers in our country, unfortunately, is cardiovascular disease. And so that is a big preventative health medical initiative, right? So when I'm looking at Vinny's patients, I'm looking at like cardiovascular risk factors, So we're going to do some lab work. Well, first off, I'm going to get a complete patient history, right? I'm going to talk to them. Usually I talk to them. I have the luxury of talking to my patients for over an hour, for getting a complete history. Oftentimes we're not in person, and I always tell them you must have a primary care doctor who actually physically can put their hands on you, listen to your heart and stuff like that. I'm here to kind of help initiate your lifestyle changes. And so, I spend an hour getting a complete medical history, and then we talk about maybe getting some lab work. Now, we're not ordering crazy lab panels or, doing reverse T3, or I heard we're not doing, we're
No
doing
Dutch tests.
no Dutch test. No. We're actually doing something, where one, usually their insurance is going to cover it with a simple $20 copay. We're getting clinical tests that are validated, to evaluate cardiovascular risk factors, for example. And, we'll often talk about, like what their cardiovascular risk looks like, and how we can lower that. And so I'm looking at the health objectives first, and then trying to see how we can modify those. And then I'm saying, all right, Vinny's going to help you on the day to day, what those lifestyle changes look day to day, which is amazing, right? How often do you get that in a medical practice, that where you can like have somebody there that you can talk to day to day to say, hey, we need to tweak this or tweak that. And then in 3 months or 4 months, we get, another lipid panel to see, if those changes actually made a difference in your blood work. And sometimes they do, sometimes they don't. And that is the reality of lifestyle changes, right? And sometimes there's a genetic, again, the root cause, there is no root cause. There's multifaceted answers. And so genetics play into that. So oftentimes, like, we'll make a ton of lifestyle changes and we'll say, hey, we'll get, a repeat lipid panel or something like that. And I'll say, you know what, there's probably a genetic component to what's going on with this clinical picture. And, after getting their family history and understanding them, and not only them, but their family and what they're afraid of. What, my dad died of a heart attack, or they had a stroke or something like that. Then we're starting to look at like, all right, what can we change medically? Like now that we've implemented all these lifestyle changes, is there something medically we need to do here to maximize your quality of life later on? Like, how can we delay that heart attack or not have it happen? How can we delay that stroke or prevent the stroke, heart attack? And how can we give you good quality of life moving forward? This, like I said, this isn't like a day change. This is a life change. These things are often practiced not only when they leave our program. We try to give them the tools that they will learn so that they can implement these changes throughout their entire life. And oftentimes clients or patients come back to us because they'll go on their own for a while and they'll do really well, but they lose that accountability and they come back for that. And to have a clinical practice like that is life changing for many people. I can sit here, Vinny changed lives before me, but I feel like this is why I went into medicine, to help people. And we are actually helping them live longer, helping them prevent chronic diseases, and helping them have that quality of life that maybe they wouldn't have had if they just continued down their own pathway.
Yeah.
Yeah, I'll,
I'm
I'll throw in my 2 cents there. So she mentioned like me prior health changing lives. It was very vanity driven. right? With what I did. Now it's very health centric and it's really optimizing the health while also making you look good too, right? And we have the ability to do that and keep you healthy. So like I started off with competitors. I'll bring you to stage at really low body fat percentage, but you're not healthy there, right? And I got completely away from that because didn't resonate with me anymore. And teaming up with her, we both had this same goal in terms of what we want to provide to our patients slash clients and what we want to them to walk away from us with. And it's really a great thing that we were able to bridge that. But she brought up a really important point. A lot of people just need that accountability, need that one person to check in with and to make sure they're doing their stuff. Because a lot of them, when they leave us, they know what to do. They learn from me. They have all the videos of all the video feedbacks that they could always reference to, but they come back and they're like, I just like the way you guys taught us and how I'm accountable. When I'm with you, I'm accountable. When I'm not with you, I kind of let myself go and I know what to do. I just don't do it. And it's like, yeah, that accountability thing is so important. So like as a coach, I'm like, that's the main pillar that I think all coaches are able to provide to their clients. It's the accountability aspect.
And that's something as a physician that we don't always aren't able to do, right? Because we are limited on time. And it's a beautiful thing, right? That he gets to work on our with our clients or with our patients on a day-to-day basis. And then I can go back in to follow up with them in a few months to see what those changes, what those differences
Month to
have
month
made.
with you.
Yeah.
She has month-to-month
And
consults with
so,
everybody.
but lab work and stuff
Yeah,
like that
that's
is
3 months, 3 or 4 months. Right?
yeah, it's usually every 4 months. It's patient dependent,
Yeah.
right? Because it's not a protocol and we don't follow, this weird timeline. So it's patient dependent. Um, but uh, we do follow up with them to make sure, hey, is this moving your health markers in the right direction? And if it's not, that's where medicine comes in. That's where we can actually medically intervene oftentimes. And that's where that multidisciplinary team comes in, not only just with us, but also where I'll tell them, hey, we need to chat with your primary care doctor. We need to get you in the loop of making sure that we're maximizing your medical benefit here.
Yeah,
Yeah.
Bryan, quick question for you. Did
Mhm.
you ever take like a coaching course, like a course that like tries to help out your coaching business?
Depends what you mean by that. Are we talking strictly business side or like like the art of coaching?
No, strictly business side.
Strictly business? Yeah.
Yeah. So I've taken a few of these too, and and I've always had this like thing now that you brought up the whole protocol thing. I've always had this thing because they're like, yeah, on a sales call, you have to have exactly what you're going to do, what you do with each client, have a PDF that shows like what they're going through in terms of
I think
phases.
we've
And I'm
had
like,
the same coach.
you, you probably went through a couple of the same courses here.
It
Yeah.
sounds like a similar thing.
Yeah, like NCI maybe thrown out there, or right? But yeah, it's like you got to have these phases and like the months, and I'm like, honestly, I don't have that with like, and I didn't know this like in terms of like a business strategy sense. I was just like, I don't do specific phases like that. It depends on where they are and then how they're responding, and they're like, no, well, you need this, and I'm like, but I don't do that, so I don't
Yeah.
need it, right?
And
And
I
it's
faced a
funny.
little bit of that too, where it's
Yeah,
like when you do coach people, you're like, it doesn't work that way.
yeah,
Or you have like competitors that will do it, and you're like, well, yeah, they're the easiest people to coach because
Yeah.
yeah,
they will literally do
Oh, yeah.
whatever you tell them to do. Now, a mom who is struggling with like no time in their schedule, who's barely able to drink enough water throughout the day, is not going to do the exact same thing.
exactly. And their phases are going to be different lengths. They might be in reverse. They're not going to go like you might need a feed phase first where someone has been overfeeding and they could go into a cut phase. Like you don't know, like you can't just predict that. You got to see how they respond. So it's funny because you had these companies teaching coaches to do these, they need to have set protocols. So it's appealing to and I'm like, no, like you're actually teaching us wrong, right? Like I don't even get me started. It's
Yeah.
your guys' podcast.
But
It's not
but
I
I
would go
totally
into a
get
TED
it. I
talk.
totally get it from a certainty perspective though, because people do like to know, hey, I'm in good hands. I know that there's a plan here. Because then you get the flip side of that of people who have never coached that like are taking people on for the first time and they're like, all right, so what do I do? And they're like, well, we're gonna get you in shape.
Yeah.
How?
Yeah.
We're gonna do it. I promise.
Yeah, I can see that too. I'm more or less like when I talk to someone, it's like, hey, look, I have phases that I want to put you through, but
Yeah.
I don't know what calories you need, what macros you need until I see you respond to what I feel like you should be at. Once I see that response, then I'll be able to tell you where we're going to go and how we're going to do it and how we're going to go through those phases. How long we're going to take to get through them, that all depends on your responsiveness. So we'll see.
Yeah. And I think that's the key thing is like there's a skeleton, there is a plan, but it's like it's
But skeleton, yeah.
moldable, it's flexible. It's not this, this, and this. And if you don't follow the plan, then you just don't want it enough and you
Yeah,
don't
yeah,
belong in my program and I fire clients. Bullshit.
yeah.
Sorry, I
That's the perfect
digress.
word.
It's like that.
That's the perfect word for it. You said skeleton. That is it. Like you have this foundation that you could fall back on, right? Or that you actually go off of, but there's no set order to it.
Yeah.
Yeah.
Yeah. But I know as Eryn, as you were talking, I had a big thing that I wanted to ask because I feel like I'm a little contradictory when I talk about this stuff, and that is electrolytes. Because I know you brought up heart disease being a big thing, and I know blood pressure risk is a giant thing as well. And being that like 1 in 2 people in the US have hypertension, I just don't see why adding sodium to the diet would benefit people on the whole. So I'm curious, as somebody who works on the preventative side of things, like with these electrolyte supplements that we see, like 1,000 milligrams in a drink, like do you see any benefit to certain people using that?
No, not okay. So here's my caveat. If you have healthy kidneys, you can do whatever you would like. If you like electrolytes, go ahead. Your kidneys will do a great job of filtering out anything that you don't need. And so if you want salt, have the salt. Um, if you have hypertension and you have kidney problems, then I would caution you against, I would be a little bit more vigilant and I would talk to your primary care about, what kind of salt intake you should have. Even that being said, most people don't have end stage renal disease where they have to be super vigilant about it. They don't, there's very rare outliers that fall into that category. And usually those outliers are going to see, renal specialists and they have specialists on board who are going to tell them different things. So I don't, I guess it's whatever your preference is. I don't think we need to be emphasizing electrolytes. Now, if you're an athlete, again, the electrolytes apply to outliers. So like, if you're an athlete and you're running, 20 miles a day or something like that, and you're losing a lot of bodily fluids, then yeah, you might feel better if you replace those electrolytes. You might not feel so depleted. But if you're like a normal, general population person and you have normal kidneys, do you like the taste of electrolytes? If you do, fine. And if you don't drink them.
What if you're a normal gym pop and you have high blood pressure?
Then I would watch your sodium intake and then maybe watch it, but you
Yeah.
don't have
So
to
it really
drink
comes
a
down
lot
to
of it.
being in that population first and foremost is like, are you one of those people?
Yes. And
Yeah.
if you have high blood pressure and normal kidneys, I would still argue like, yes, be cognizant of it, but you don't have to obsess about it. Get your
Okay.
get your water in, get your intake, get your fluids in. If you want to put a little bit of salt in there, there are other things that will affect your blood pressure more. One that I like to say is that if you have high blood pressure and you're slamming monsters all day long, not the best combo.
You do not want to see what's in the garbage behind me.
If you have normal, healthy kidneys and you're accustomed to taking that much caffeine, then knock yourself out.
Yeah.
Um,
I
but
use the ADD as my justification. It's like, it doesn't make me anxious, it makes me focused.
I will say that I have a decent amount of high school wrestlers that I coach. And there's a lot of them that want to make weight. And the whole thing with wrestling is like obviously like your body weight's at a certain weight, but if you drop lower, you'll have a better chance of winning your match, right? And I try to push them against that because they're growing kids, but sometimes you just can't talk them out of it. So a lot of times there needs to be some form of water manipulation, but they have a lot of good now hydration tests that all high school athletes go through, which I absolutely love. But one thing that I do have them do is I have this little like hydration drink that I have where they're going to take it after they weigh in. If they feel like after practice they need it, they'll mix it together and they'll do it. And a lot of that is just like Gatorade, Pedialyte, some water, and maybe even some more salt in there. It's nothing too crazy, but the electrolyte aspect of it with an athlete that has to do sort of weight cutting and water manipulation, I feel like it's very important to have. So I would just throw that little caveat out there.
Again, these are
Depends.
so you have to look at, yes, and it depends is probably the best answer ever. But you have to look at, again, we're treating the patient, and so you have to look at the whole clinical picture. And so, again, what's their medical history? What's going on? Do they have normal healthy kidneys? Most of the people that we work with have healthy kidneys.
Yeah.
So I say, if you want to put salt in your water, whatever. Like, go
Yeah.
for it.
I do that right in the morning with
If you
with
like
clients,
that,
yeah.
go for it. If you don't like that, don't do it. I drink Gatorade Zero all day long. I love it. I think it's great. It
We're big
has,
fans too.
yeah, has some electrolytes in there, but it has mostly it's the flavor. I just like the flavor, and I don't like drinking plain water. If
Yeah.
anything, be careful with drinking a ton of plain water throughout the day, especially if you're not accustomed. Hyponatremia is a real thing. So, people die from that. So, again, an outlier, an outlier. So just if you have normal healthy
Everyone
kidneys,
listening
use common sense.
who's a coffee or tea addict or like soda addict, they're gonna be like, well, Dr. Russo said.
Yeah, and if you like diet soda, drink it. Drink diet soda. I'm all about diet soda, especially if it's going to replace something, a sugary drink. It's better than drinking the sugary drink calorie wise, right?
It is pretty funny how like butthurt certain people get that diet soda outperformed water when it comes to weight loss. It's
Yeah, because
pretty
it
nuts.
I used to abuse Diet Coke when I was in prep, like a couple weeks out from a show. It helped curb my appetite.
Yeah.
And it would just make me feel like I'm having like a little treat. And it was 0 calorie. And I'm like, I don't give a fuck. Got a little bit of artificial sweetener. That's not ruining my physique stepping on stage, you know?
Yeah.
So
The
yeah.
only
I,
reason I used to do the same thing, like for just generally, but then it started messing with my gut. So I'm like, oh, okay, clear indication. I can't get away with this, but it doesn't mean other people can't.
Yeah, yeah, yeah.
yes. Yeah, use common sense, right? I feel like sometimes we rely on all this information when it's like, honestly, like you're going to know your body the best. I rely on my patients a lot to tell me like how they feel, like what does that feel like, and let's go from there. Again, that's that clinical picture that oftentimes gets missed.
Yeah.
So,
Yeah, for sure. And now I want to be respectful of your time, guys, because I'm so appreciative of you taking the time out to do this. I just have one final question to wrap this on. And I like asking because you guys are parents and I am not yet. Um, but
soon to be probably.
in the future, in the future. But I gotta ask, being that you guys are busy, like I know you got a lot going on. Do you have any hacks for like being a parent and still getting the job done? Because I think that honestly is one of most people's biggest hurdles when it comes to their health. Do you have any things that like really have helped you out?
Honestly, like for me, I keep a set of weights in my office. I used to be a very type A kind of personality of like, I need to get my workout in. It has to be a certain time. Granted, I have a 12-year-old and now a 1-year-old who still wakes up in the middle of the night, by the way. Just getting better, but still, some nights we don't get a lot of sleep. And so I keep a set of weights in my office, and I honestly will do a few sets between patients because I figure getting in some resistance training is better than getting in zero resistance training. And so I try to do that. I also have a stationary bike in my office. And at lunchtime, I will do my clinical reading while I'm on that bike. So I get a little bit of, cardiovascular um, workout there. Not much. It's not great, but it's better than nothing. And I think any amount of resistance training, even if you can get in 10 minutes, whatever, 20 minutes, I think that that is great, especially if you're a parent. Give yourself some grace. It's hard to get up in the middle of the night and then go work a full-time job and then come back and also, care for your child. And Vinny has a completely different perspective because he's running his business, our business from home with a 1-year-old. and he has way more interruptions than I do clinically in my clinic, right? I get the job interruptions, not a 1-year-old who's like, I must be held and I must be fed right now.
Yeah.
Hey, as a new dog owner, and he's about 4 months now, I sympathize because I can't imagine how much exponentially harder that is with a human.
Yeah. No, I
Plus
mean,
we have the dog.
yeah. Plus, I got to deal with that nut job throughout the day too. But I will say that the main message Erin's trying to get across is make your environment support what you need, right? And if you have that in an office and you can do that, great. At home, in your bedroom before you go to sleep, great. Like make your environment support what you want to do. I will say though, my piece of advice is if you do have a significant other, if you're not a single parent, you do have a significant other, lean on each other. Like it's okay for you to ask your spouse, "Hey, I need an hour and a half to 2 hours. Let me go to the gym. Let me do my thing there." Like she on Saturdays, I like to box. That's the only time I could really go do it. And she takes the baby and just like, yeah, I'll be back. It takes like an hour to get there and an hour back. Plus, it's an hour session, so it's a long time that I have to myself to be able to do it. And she's like, yeah, go ahead, you enjoy it, go do it. So she allows me that little bit of freedom, and I feel like communication with each other is key. Like if whatever she wants, if she's home like today, if she's off of work, and she's like, "Hey, I want to go get an hour downstairs." Go ahead and go do it.
Yeah.
I take an hour. I'll watch the kid for an hour,
Yeah.
and then maybe I want to do it after her. Hey, can you watch now while I go? Okay, cool. Let's go do it.
Yeah.
So that communication's key, and just give each other grace. Like allow each other if you need to go take a walk by yourself because you got to clear your fucking head. Don't get offended by that. Let them go walk and clear their head and come back. She'll be happier if she does it. Let them do it.
Yeah.
Right? It's
I
okay.
mean, this screams easy brownie points. It's like, babe, go do your thing. Go do your
Yes,
thing. It's
yes,
okay.
yeah, yeah. Well, and if you honestly, if it's a give and take and you both are a team, then your team member is also going to allow you to do stuff. So
Yeah.
especially if you are the one that's like, all right, you go do this and I'll go do this, it's a give and take any.
There's no resentment there
Yeah,
because you guys are both working at it together and you both understand how difficult it is. So allow each other to listen. If you need a break, it's okay to ask. If you could say, "Hey, can I get an hour to myself, an hour and a half to
yeah,
myself?" It's okay.
yeah,
Just do it. Don't be afraid to ask.
yeah.
Yep, 100%. I'm so glad you brought up environment because that's literally what I had in my notes right here. Because people find it really tough where they can't stop snacking at work because the snacks are right there. What if we
Yeah.
use that same logic with the weights? It's literally staring you in the face. You're more likely to do it.
Yeah.
Yeah. Well, and like I said, I'll do it between patients. I'll be like, I've got, 10 minutes before I have to see the next patient. I can do a couple of sets, while I'm waiting. And then when I'm done with their appointment, I can do, a few more.
Yeah.
And so
Yeah.
I get an okay workout in, and I will say that it's better than nothing.
Yep. And that's another important point too. Something always beats nothing.
Yeah.
Because even if it's maintenance, which is so underappreciated, like not going and taking steps backward is a gigantic win, especially if it's a tough season of life.
Yes, yes. And you know what? That's the other thing is like people don't realize like this time in our daughter's life, it's temporary. It will pass. We will have more time. It'll change. The dynamics will change. It'll be fine. It's a phase. And so you gotta think that these time restraints or time challenges, they always change. They're always changing.
Yeah. You shift the priority from hitting PRs with the weights to actually changing diapers. Like the priority shift. And that's okay
What's
for now.
harder though? That's the real question.
Yeah. Changing diapers, man. They could get to you.
Looking forward to that
Yeah.
stage. But anyway, thank you guys so much for taking the time out to do this. I appreciate you both being here and imparting your wisdom because this stuff I really do believe makes a difference and helps the people listening. So thank you very much.
Oh, thank you for having us. We
Yeah.
really appreciate
Thanks
it.
for bringing us back on again.
Yeah.
Of
Appreciate
course.
it.
Oh, very happy to. And if you guys want to do another one, open invite. Now, if somebody's listening and they're like, wow, they're both incredible. I want to follow them both. Like where can people find you?
You tell us.
So you can go to our website. That's www.balancedbodies.io. You can reach out to our Instagram. That's where we're both pretty active on social media.
Trying to be. I'm trying to
She's
be.
trying to. Hers is Dr.Eryn at balanced bodies, and
Yeah.
mine's Vinny Russo at balanced bodies. Wait, is it? No, underscore.
Yeah,
right?
underscore, yeah.
Underscore, not at.
Yeah.
So
Well, it'll all be in the show notes in the description, so you guys don't have to worry. Just click away.
Just do Google, man.
Yeah. And you're guaranteed not to see wellness or holistic. Guaranteed.
Yeah, no, those
We
are
got rid of
gone.
those, yeah.
Except for our LLC name, because wellness is in there. We can't change it.
Well, you're stuck with that. Just like I'm stuck with Coach Fitz with 2 Z's. It was dumb, but it's there. It's stuck.
Yeah.
Listen, it might be dumb, but it fits.
I still have
That's
part
a dad
of it.
joke. That's a dad joke.
Is that what happens? You have a daughter, and then all of a sudden it starts clicking
It's just
mentally.
dad jokes now. That's it.
Great. Well, again, thank you guys. And thank you to everybody listening who made it all the way through. We appreciate you listening, taking in all this awesome information. And the only ask is at any point, if you heard something and you're like, wow, that is really important for X, Y, and Z to hear, like my mom, my sister, my dad, whatever, and you have somebody in your life and you're like, they need to hear this, send it their way. They'll appreciate it. And so will we. All right. So that's it for today. Thank you guys. I will see you next time. But until then, go kick some ass. Bye-bye.
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.